Well, is COVID creating a bigger gap between the rich and the poor, or just revealing that the gap is already there? COVID's revealed many things about our world today, but what's its impact on the poor? Does COVID cause more harm to the poor, or are they getting off this worse? Or are we not hearing about it? What's the deal with the actual disease?
Yeah, for me, this is just such a huge important, because in today's world, we look for simplistic solution and memes. And you and I, Steve, we never do simplistic. And we should especially not do that in dealing with COVID, because it's a complex issue and one that requires balance. So we're going to look at what is going on in Africa and how things could be better for the poor. Well, you know, Steve, you know this, that I like to pontificate about things I know very little about, as do you, you know slightly more. But I thought when we're talking about Africa, I would get somebody who lives in Africa, who works with the poor in Africa, and who's got a master's in world health. So have a listen to part of an interview that I did with the woman called Marcelle.
Anybody who really loves global health and it may know of something called the Alma Ata, which I believe was like 1940 something, the United Nations, and a group of people. Basically, it is promoting universal healthcare, and it does have a holistic approach. In some ways, very much on the physical, but it emphasizes safe drinking water, access to safe water. Adequate nutrition, immunizations, shelter, and then the infrastructure around that in terms of a tier system. So for village health, and I talk of village health even in Portree in the Isle of Skye, you know, you don't often need to go straight to see a neurosurgeon, which sometimes North America has a reputation of that. If you have a headache, you go see a neurosurgeon. But a tiered system. So would really promote universal healthcare. And yeah, I think a lot of governments do have that. You know, you have the Ministry of Education and such like, and I don't know how much, you know, decisions are made bringing in all of those different aspects, because they've opened the airport for tourism, which is significant for economy, but it actually gives a lot of mixed messages to where the high risk transmission groups are.
Yeah. I mean, just in terms of this balance thing that I'm talking about, I looked at the figures for malaria for Uganda, and as you were saying, COVID, 12,000 cases, 114 deaths. Malaria, the last figures I could get, I think, was 2013, and it was 16 million cases and 10,500 deaths. I mean, that's astonishing. That's from malaria.
Yes, and that the reality is that's only a fraction.
Yeah.
Because so much, I mean, we have, again, statistics, but a lot of the populations that are the highest risk, there's nobody counting.
So who is Marcelle and what does she do?
Marcelle is a Scottish woman who has been working in Africa for a number of years. She works with an organization called Dwelling Places in Uganda with the poorest of the poor. In the interview, as she says, she talks about how the world, the WHO talks about poverty as being $1 per day income. The people she works with have far less than that.
That's terrible. And so what is the situation in Uganda? I know a few people from Uganda. Is there anything that surprises you?
Okay. Uganda has 45 million people. 12,000 have been tested with COVID. There's 114 have died. Now, to set that in context, last year there were 16 million who had malaria and 10,500 who died from malaria. But as Marcelle points out in the interview, those are only the figures they know. They know it's much, much worse than that. One of the interesting questions about
COVID is how in Africa it's not been nearly as prevalent. They think it's maybe because of the sunshine, maybe because of the young age, or maybe just because of the lack of testing. But it's an incredible situation.
Mm. So there's what you have in one problem like COVID that seems low seems to pop up in other big issues like malaria. So, and she speaks of universal healthcare. Is that possible? I mean, it's an ideal. Do you agree with that?
But I do, because I think it's what governments should espouse to. I think it's what communities should aspire to, rather. And I'm not sure how we get there. I'm not sure that you're going to get many churches running full-scale hospitals. But universal healthcare means that you are not focusing on just one particular aspect. So with COVID, when you have a lockdown in Uganda, what happens is the poor don't get to shop, because the shops close between 7 and 6 in the morning. And most of the working poor, they get paid daily and they can only buy food because they have no fridges on their way back from work. But if the shops are closed, they can't buy anything. So universal healthcare is an idea of looking at the whole of society. Like in Australia, we would think about mental health. We would think about COVID and diseases. We would think about hospitals. We would think about all these different things. And I think that if anyone should be for universal healthcare, it should be Christians.
So summing that up, is there a specifically Christian response to it? And what underpins that, Dave?
Yeah, I think there is a specifically response to COVID and also to the poor. And I want to put it as simply as this. And I realize that there's a lot more that we could say, and I hope that this is a discussion starter for people. But in terms of COVID, I think the Christian response is to recognize that all of us are dying, and that we are to prepare for that. I think it's also to recognize that there is injustice in the world, and it's also to make sure that we're not just defending our own corner. So you live in Perth, one of the richest states in the world. I think actually if it was a geographic country, it would be the 10th largest in the world. And your premier, for better or for worse, has decided to shut all the borders. And part of the attitude of that is we're going to keep us safe, never mind other people. And I think you get that with Donald Trump. Sometimes you get that in different places. We become very tribal. Christians should be saying, no, we need to care for the whole world. And we should be concerned about Africa. As regards the poor, I think that should be an absolute priority for Christians. Why? Because that was the priority of God. That is the priority of Jesus. And I know for some people that sounds like a political statement. I don't care. It's not. I think a lot of people who talk about the poor who are political, they don't do very much. And I think of what Marcelle is doing, with hundreds of street kids. And I'm thinking, Lord, that's what we should be doing. So I do think there's a specifically Christian response.
That's great. And what about thinking too that helping the poor isn't just giving out of our extra, it's actually giving our lives to that. So that's quite a challenge that she's doing. Any Bible verse?
I do. It's a verse that dwelling places really have taken for themselves, and it's from Isaiah. And it says this, if you do away with the yoke of oppression, with the pointing finger and malicious talk, and if you spend yourselves on behalf of the hungry, which is what you were just saying, you spend yourselves and satisfy the needs of the oppressed, then your light will rise in the darkness and your night will become like the noonday. The Lord will guide you always. He will satisfy your needs in a sun-scorched land and will strengthen your frame. I think for those of us who are Christians, this focus on the poor, it's not a side extra, it's not a political viewpoint, it's the very heart and essence of our faith. And listen, before all the heresy hunters get in, that's not the social gospel. That is the gospel.
Thanks, Dave. Good words to think about and good words to leave us on as we go into next week. Next week, we're going to look at a different topic altogether. Brave New World or 1984? Are we heading for a soft totalitarianism or a hard one? So that's what we'll be doing next week. See you then, Dave.
See you then.